Okay, hello there, Paul Haas, Sports Physiotherapist Australia, here to talk a bit about ACTIVETAPE version 2, but more particular, a really neat technique that I get asked about all the time in situations where you might want to provide for the ankle joint some stability, some compression and moderate support that allows correction, but without actually worrying too much about actually having to protect the ligament. Because sometimes people are hypermobile, where they have just extra movement, or we might have children who have overload of muscles and tendons and they pull on the apophyses and they get growth plate problems. So sometimes we don't want to use the old traditional rigid that just completely locks things up. We want to use a different tape. Now, one thing we don't use for these things is kinesiology tape. This is not a tape for support. This is a tape for blood flow and pain relief. And this because the tape rips, okay? It's not that strong. But one really important thing about our tape range, and probably one reason we're excited about being in the market, is that we've been able to create kinesiology tape family, rigid tape family, and active tape. So everything, it's a one-stop shop, all under the one banner, which means you can make really good choices for your patients or your athletes. Okay, let me show you something really cool. Let's get down towards the ankle here. So here we have the ankle joint, which is mainly made up of the two long bones of the leg, so the fibula and the tibia. They come into the talus, which is like the knuckle of the ankle. Now, the main support of that is the ligaments. Now, if we want to really lock that up, we'd use a rigid tape. But I want to show you where we don't want to lock, but we just want to provide moderate support for the joint, but also very good support for the tendons and muscles and compression. So let's think about the properties of the active tape. Now, the active tape is a storage system, so it stores energy and releases energy in 4 ways. So 1 way, 2 ways, 3 ways, 4 ways. This way, that way, that way. So the great thing is that when Amy moves her ankle in different directions, the tape's capturing that energy that normally would be captured by the muscles and tendons. So we're shifting the load. Okay, so I've got here I've got a double tape system here. So this is a multi-layer, 2-layered tape system, which means there's more support. It's a 7.5 centimeter width for more purchase around the ankle joint. And you'll see that the actual tape, what it does, it's able to conform really nicely to this area. So normally when we tape the ankle joint, we want the ankle up in what we call dorsiflexion as much as we can. Okay, so the foot's up. Now with the active tape, it's very easy to use. So I usually put the tape on the bottom of the ankle, okay, just under the calcaneum, and then we then create these 2 lever arms that provide compression, stability and support all together. So Amy here is going to lift her foot right up into dorsiflexion. Yep, that's it. And we're going to stretch the tape. Now I only stretch about 10%. We massage the tape in and we bring the tape across. Okay, so we've got some energy systems like the peroneal tendons here that now will be supported by the active tape on the outside, the lateral side. And then Amy here, just roll your foot inwards a little bit. That's it. And we just invert a bit, because we shorten the lever and then we provide the support. So if we just get in nice and close over the top, we then get support of the medial structures and the tendons also. So in kids in particular, the tib post tendon, which pulls on the growth plate there. So this is a really nice way to moderately support the ankle, provide some force closure and stability, and also create energy storage in the tape rather than the actual muscles and tendons coming down the leg. Now, if you're not satisfied with that much support, we can even add another layer. When we add layers, all we're doing is we're increasing the storage system. So basically, with the foot and the ankle being at the end of the kinetic chain, there is a lot of load and force transfer between structures. So the active tape comes in and it starts to change that. So it starts to take a good amount of that overall energy into the tape. So here we just provide another sling medially. We don't put any stretch on the anchors. And again, we go up, a bit of stretch on the actual tape, just a little bit. And then we lay down the rest of the tape system. Okay, and then we provide that support. That's very supportive to the ankle joint. It still allows movement, but we're increasing the moderate level of stability, force closure, proprioception and compression, which is really, really important in those situations where you want to provide that level of support. Thank you.